the idea of a Twitter chat where we can collaborate, meet new people, people who are interested in medicine and how the technology can shape the future of medicine, and in particular ethics and sort of career building, I think is just awesome. Something I'm really interested in, and I was totally blown away, to be honest, with the just the amount of people that were involved. I didn't expect there would be so many responses. I thought it was just us four medical students, or three medical students from Florida Atlantic, and there was even somebody from Mount Sinai, I guess, or Einstein, who joined in.
Yeah.
But no, there were like hundreds of responses to each question, and it's just coming from every angle. Lots of people responding to everything that I'm writing, and not just for the hour, for the next day. People from all over the world. So really interesting idea. I think that that really is in the right time. It's not ahead of its time. It's not yestertech. It's really like its time is now. So I'm interested in how technology can shape medicine, how we can use these tools for our own wellness as well. So Twitter as a form of self-expression. How can we use technology? People are coming up with diagnoses on Reddit subfeeds and on Facebook chat. There's an algorithm which is guiding us to the best answer, and people are using this for their own health. Whether we can bill for it or not, I think that's a separate discussion. But it is the future. So I was just very, very grateful to be a part of it. I thought that some of the themes that and so thank you very much, to Dr. Gundersen and for you, the organizers, for including us with our sort of limited scope. It is great to be able to sort of learn from all of the minds that have been thinking about this big topic, which is going to really be so impactful in our careers. When we're just starting out. So,
yeah, and you're an important voice, I think,
yes,
in this. And
thank you.
And I was kind of curious, what sort of resonated with you? What sort of idea or perspective do you think you heard or saw in the tweet chat that sort of resonated anew with you?
Well, the photo I tweeted out right before to kind of promote the chat was from this paper about the masks, where they in Maryland at the Academy of the Military Sciences, they actually had students build these masks, and there were other people who posted other mask photos, even in our HMI chat, which I thought was interesting. That was one thing, was about sort of the integration of the public identity with the private identity. For me, that's a huge topic.
Mm-hmm.
I was a DJ. How can I connect these two different worlds, where it was like nightlife and being outgoing? Well, I found a way, because I found the wellness community. Like, I found the yoga community. I found people who are interested in medicine that are also interested in being healthy and staying healthy. Dr. Meta down here, etc. Integrated medicine specialists. So, and then the other thing, I thought the other theme, other than integration, was about humility. I thought that a lot of the posts, a lot of the topics were about, the way to grow is to stay humble, to remember that you're always a learner. For me, maybe that's not. It's not hard for me to remember that, but I thought that was one of the points that kept on getting hit.
I think that's a really neat point, because I sit back and I think about who did I admire when I was in medical school, and sometimes there is a little bit of hidden curriculum with people that were seen as stronger folks, but then again, those were just usually limited to a certain skill or something, versus the people that were humble. Hedy, do you want to tell us a little bit about what resonated for you?
Sure. I just wanted to say what was so amazing for me was, I agree with Isaac, was the breadth and depth of the dialogue. and how some of these core themes were coming out with folks that are just bringing their own personal experiences within their own formation or what they were trying to do with their students. And I found that really interesting. What I loved was a lot of the dialogue was discussing core values or core attitudes and beliefs and the shaping of a professional and how seriously we take that, how seriously the students were taking that, and thinking about our own professional identity formation as a lifelong dynamic process. What are we doing about that for ourselves so that we can stay resilient and engaged for being proper role models for those students? And I would venture to say, Justin, if you took time to really think about who were those amazing role models for you, it might be the folks that were able to establish authentic relationships and be able to share, as some folks said during the Twitter chat, sharing my failures or sharing my true experiences. And I had actually tweeted at one point, don't forget the triumphs, because we want to bring those excellent stories as well. What are the negative role models? What are the positive role models? What are the peers? What are the patient stories? That openness to transforming amongst all these various factors that can impact a professional identity formation. I really liked that in the chat, that I felt that all those angles for that lifelong formation were coming out, and we were getting to the Liz's idea around 4 tree images for our 4 questions was, what are we feeding that soil? What are we doing to help nurture those roots and branches and trunk, etc.? Okay.
Yeah, that's an interesting point. I wonder, Liz, if you kind of start off by commenting on something that Hedy was just saying there about developing these authentic relationships. At first blush, I might say that it seems easier to develop those in my residents and fellows because I have these more prolonged longitudinal experiences with them. For me, versus medical students, I don't have those as much, but maybe that's just something because of my particular situation.
Right. So, perhaps Isaac could comment more about my model of teaching and how I've tried to impact the medical students. But it's been a journey for me as well. And I like what clearly role modeling was a big theme that came out in the Twitter chat. And Hedy was a good reminder for me about focusing not just on negative role modeling, but on positive role modeling. Because as I conduct the ethics curriculum and the students write about ethical dilemmas they've faced in the wards or in outpatient practice, most of those stories that come in are examples of negative role modeling. And so when I was first exposed to it, I got really just sort of distressed. I felt distressed myself about what the students were going through. And sometimes it's easy to get lost in that. And now I've tried to encourage our students to also present cases that reflect positive role modeling, to bring in that positivity and not forget about that. But in terms of authentic relationships, that's also been a journey for me, because I think it is hard to get up in front of a class of students, and I do a lot of didactics every year. So, I know what people say about lectures, but I give a lot of lectures. Trying to be authentic and humble and vulnerable during those lectures has been at times challenging for me. But what has occurred to me as I've been teaching for the past few years is that we expect the students to sort of serve themselves up on a plate. We want them to reflect. We want them to be vulnerable. We want them to expose their challenges. And so I feel like if we have that expectation of the students, we really need to model that ourselves. And so I've really pushed myself to do that. I think one recent example in my own teaching is that and Isaac has heard this story. During one of my talks before the students enter their third years, I talk about when I was a third-year medical student and a resident attempted to assault me. And after the talk, and it's always a very difficult talk for me to give because I'm really exposing something very vulnerable. And after the talk, one of the students gave me a hug. And at first I felt really awkward about that because I didn't want to set it up as, oh, I need help, I need to be comforted. But at the same time, I thought, that was my point in telling the stories, that I want the students to come forward when they need support and when they need our help. And so I had to pull in that and accept the hug from the student because that's what I was trying to role model. So that kind of vulnerability, trying to be authentic with the students, has been a priority to me and also a challenge at times.
Yeah. Isaac, you want to jump in? I think Elizabeth just kind of knocked it to you a little bit to comment on these faculty that you see or that you identify. Maybe, I guess the question is, can you compare, contrast faculty you've been more successful developing an authentic relationship with those that you haven't?
So I missed the last question. Can you guys hear me?
Yeah, we can hear you. The question is, can you compare, contrast the faculty that you've been able to develop authentic relationships with versus faculty in the medical school that you have not?
So, I think that in general, because of our class size, we have a pretty small school. We're able to kind of get attention from faculty when we want it. I don't want to say it's like an age thing, but I probably have connected more with the younger members of the faculty. The ethics curriculum is actually pretty interesting. I wouldn't say it's mostly didactics, because the experiences for me that were sort of like really the most impactful were one, doing the writings, and then presenting it to the group and kind of hearing from the rest of the group what their experience of the right and wrong was, and people do kind of tend to bring to light the darker side of the medical world that we're sort of witnessing for the first time. But I think that shifts also as new spaces are added for us to share those things, which we sometimes don't have any outlets to communicate. Which, like, for example, the feedback sessions before didactics, where we can sort of just get things off our chest. Anyway, the most impactful one for me was there was a communication session where we were giving the news that someone was dying for the first time, which was facilitated by clinical psychologist, geriatric psychologist, Dr. Bensadon. I came into it thinking I was really well prepared. I was going to, do a great job, and I kind of knew what I wanted to do, and I ended up coming away from it just really thinking about all the ways that I could have done better, and all the different tools that I could have used. So there's lots of learning to be done in that, how to communicate, how to and more, I think, is the key. The more we can get of that in person, one-to-one communication is the best.
No,
I wondered if I could just jump in here, Justin. Good timing.
Absolutely.
I've been sort of trying to digest all these comments. Isaac, thank you so much. I think from what Liz was just saying and Isaac was just saying, I wanted to really emphasize and highlight a point that came through very clearly in the Twitter chat itself, is that this professional identity formation process is not by osmosis. This is about professionalizing medical education and coming to this with a really educated view. When Liz was just talking about how she was thinking about what to say, when to say it, and what the reactions might be, that's a very reflective space. And she's creating a reflective space is what we're doing in our strategies, and one of them is guided reflective writing, is creating a certain kind of reflective space. A paper we did talked about guided mentored portfolio within residency, or whether there may be other types of strategies. Thinking about this in a professional sense as an educator, I think, is crucial in how we create the reflective space, how we provide certain types of feedback, and how do we have the learner, like Isaac, feel that not only is he part of socialized group of medical students, but he's Isaac, and we see him. And this is one of the reasons that I've done a lot of scholarship work in guided reflective writing, that the feedback that's given is personalized within a socialized framework of I see you, I hear you, you're on a developmental journey. So I wanted to kind of highlight that, and I think it reflects also on guiding the professional identity to prevent burnout, because by having those types of relationships and development over time, I think it can help a learner to grapple with complexity and with tension and with uncertainty, which is part of being a professional. So I've kind of thrown out a few different things. This is not stuff I made up. This is stuff from literature, but also what was happening. And I see Liz is shaking, nodding. We saw this in the Twitter chat. If you take a look at the responses, this is what was coming out from folks. And there was someone from Nebraska who actually said, what about our professional identity formation as a medical educator? Mm-hmm. Which then, again highlights the importance of faculty development and thinking about what we are doing in a developmental sense. How guiding that moral compass, the way you're doing with your ethical dilemmas and the stuff coming through in our reflective writings as well. How do we use a medicine and the Holocaust curriculum, which Isaac and I were in touch with, to think about scaffolding professional identity? And I'll just finish by saying this. Isaac was in touch with me after the chat through email, and I shared some articles with him. And I mentioned this to Justin, how beautiful it was that we were actually changing our professional identities even through the Twitter chat, as Liz mentioned. And then I had this new professional relationship with a student that was interested in getting more articles. How beautiful is that? Okay.
That's fantastic. I think that highlights this beauty of this format that Twitter lets us have. I mean, we have this opportunity, and not only is the good that we're seeing bouncing off of each other in the moment, it's being captured on Twitter, but also these relationships that we're carrying forth, which probably brings us into a nice point where, Elizabeth, if you would kind of start to bring us home about, maybe reflecting, where do you think we should go from here? What now? What should we do? What is something that we may set our course and start doing a little direction on?
Oh gosh, so many directions to go on. I was just struck really by what Hedy was saying about relationships, and that's something that I know she's written extensively about, and that I think that we've come to learn that these relationships are so crucial. And when Hedy's doing guided reflection, it's not that the students are producing something and it's going out into the ether never to be seen again, but it's this collaborative process, which I think is so important. So I think that part of what we are already doing to sort of go into the future is just raising this into our consciousness, that this is something that is important, that is as important, if not more so, than anything else that we teach in medical school. And just use the term that nobody likes of, say, the soft skills or the soft science that this is considered to be, it really needs to be reclassified as something that's essential and critical to medical education. And I think we're already moving in that direction. And then again, we also talk a lot about co-creation students, and that is something I think that we're realizing more and more in medical education. It's just so crucial that we don't necessarily know what the students need. The students know what they need, and so we need to co-create with them and find ways to do that.
I love that idea of co-creation. I mean, that's something that this Twitter chat really has been an evolution of with Teresa Soro and Alyssa Hall, and co-creation absolutely has been really powerful in my life recently. Hedy, as somebody that leads workshops about this topic, what are your thoughts on where the HMI community should go from here?
I loved what Liz said, and I think that coming out of that idea of the co-creation, I think this idea has to be paramount, that we don't do to a student, we don't make, we don't even form or build. I don't like that word build. It reminds me of bricks and mortar, okay? Even the word shape, sometimes I get a little nervous on the ceramics wheel, okay? I think we need to be thinking about joining, co-creating, joining on the journey, which is sometimes an overused word, but it's okay, all right? And by doing that, it's a really beautiful thing. I think joining on the journey, whether it be through the ethical dilemma work that Liz is doing, or through guided reflective writing, or a mentored portfolio, or other types of reflective space, even in simulation work, as Isaac mentioned, in learning certain types of communication skills, this also you grow as a professional. So I think that coming to it with a dose of humility, to bring us back to Isaac's initial theme comment, is extremely helpful. The other thing I'd like to say, you mentioned workshops, is that to take this seriously in terms of faculty development and what we defining professional identity formation and the strategies to use. And that also relates to our own professional formation and our wellness, our resilient skills. And a lot of the workshops I'm involved in relate to that, because that is going to not only have a ripple effect, but may have a wave effect. Because the beauty of that is this lack of cynicism stuff that gets into students' heads at an early point in time and affects their professional identity formation. We don't have time for that or need for that, and that's across the spectrum, even into residency and beyond. So, I think taking care of ourselves, developing our medical educator skills, thinking about what do we mean by professional identity formation, what do we think about interprofessional identity formation, which didn't come through as much on the Twitter chat, but how do we differentiate ourselves from other professionals or work within teams, what links us, what is the same, things like that. And one last point, and that is we get a little intense sometimes around assessment. So I think we have to be careful and cautious, because formative assessment, yes, but when we get to summative assessment places, let's be gentle and be careful and think about our learners and where they're at in this process. So I kind of wanted to put that out there as well. And what we had talked about with the co-creation and the shaping and things like that, there is one idea that kind of came through the chat, that there are some core values, attitudes, and beliefs within a profession. Okay, so I don't want to give an impression that this is kind of freewheeling. It's not. Mm-hmm. I think it's more around the rigidity that we have to be careful about, and being more learner-centered in guiding the professional identity formation. As Isaac mentioned, there's a lot of different factors a student brings in with them, and the sort of resources that impact them and the factors along the way of the 4 years. So I just wanted to kind of highlight that good mentors can bring that out in their behaviors and in their interactions of what we hold dear as our core values. Okay, so I just wanted to mention that.
Absolutely. Wow. Excellent points. Isaac, I think the pressure comes down to you. We talked about co-creation and really the need to engage with the medical students. Hedy doesn't want me shaping on the ceramics wheel. From a medical student perspective, how can medical students become more engaged, you think?
Two things I wanted to mention. The one was this kind of soft way, this way of kind of continuing relationships in like a less formal way. So I can just a post, or I can favorite a tweet, and it can kind of continue a relationship in a way that, it's not such a formal kind of like staunch thing. So I'm interested in that, but also I think one of the sort of directions which or concerns about the future goals for me is this idea of the echo chamber. So when I was at Centil, as part of this panel talking about resilience and wellness, I felt like the whole audience was sort of on the same page as me. Everybody was already on board. I wasn't convincing anybody of anything. And so my question is sort of, how can we share this message and get this, to the rest of the world? I think Twitter is great. But the people that are involved are sort of always going to be the people that are interested in this. And when does it become, mainstream? How can we get sort of this message out there and be heard in an even bigger way?
Wow, Isaac,
How can the rest of my classmates get interested?
I think it's a neat way to sum this up, because that harkens back to the idea that it's important to have experts like Liz really showing us what's best practice, and folks like Hedy leading faculty development, taking this seriously. All right, and on that note, we'll close out for now.
Thank you.
Thanks, guys. Appreciate your time.
Thanks so much.